Hello everyone, and thank you for joining me on this episode of Ask Dr. Ken. Now, I'm really excited about what we're going to talk about today, and it's good that I have two experts in the house who are going to thrash this topic. I have Dr. Ken. He's a consultant gynecologist, he's an IVF specialist, and he's a minimal access surgeon. And I also have Paul Swanji. He's a clinical embryologist with a specialty in genetic editing and molecular biology. Now, those are really long terms, please forgive me. And my name is Annie Umaru, and we'll be talking about egg retrieval in the IVF process. Now, I know that in the IVF procedure, you would have to actually get the egg out of the woman and bring it out somehow. I don't know how that is done, but it is done. So like a layman, yes, okay, let me just ask you, what is egg retrieval or oocyte retrieval? I think I read it somewhere. That's what it's called.
You're right.
Yeah, we call it oocyte because calling it egg actually makes you feel like you're talking about chicken
Egg.
Oh yeah, so oocyte retrieval or egg retrieval.
Yeah.
Well, it's one of the processes, one of the last processes in an IVF treatment cycle where a woman's eggs are retrieved from her ovaries and sent to the lab after due medications have been administered. So in a nutshell, that is actually what egg retrieval is, the last stage in an IVF treatment cycle.
Okay, sorry, before I ask any other questions, I wanted to ask also that for a woman, what is the age range for this procedure to be carried out? Because I know that at a certain time in a woman's life, she gets into menopause or whatever it is, and I guess there are no eggs that are released. So what is the best age for a woman to have this procedure carried out so that they would eventually she would actually have an egg that is fertilized? What's the age range that you can
You know, up to this time, we have up to about 46 years of age for eggs to be retrieved. You know, it's not a straight for the age bracket to mention, okay? Because we would rather be talking about getting the quality of eggs at certain age and all that. If you're thinking of just egg retrieval, for instance, at any age where a woman is made to produce eggs, the eggs could be retrieved. And that's to say there is no age limit. With what we know in science today, I can confidently tell you there is no age limit. Because we've had women that we've done ovarian rejuvenation for using PRP stem cells and even growth hormones that are beyond 52.
Okay, so
and we have retrieved eggs where they don't want to accept the option of using donated oocyte, donated eggs. But for conventional reproduction, from below the age of 46 is good, because at 46, for instance, statistics has it that only 1% of women of the woman population will get pregnant with their own eggs when it is retrieved. So that's why I put the benchmark at 46. But if she has other scientific gymnastics carried out on her, like ovarian rejuvenation, you could retrieve the eggs at any age that you have success with ovarian rejuvenation.
Now, that's good news for a lot of women. Because we have a lot of women who are career oriented now. They want to stay till they are 30, 40 before they even think of marriage. So I think that's good news. Is there something you want to add?
Yeah, like you said, for career women or people who are not ready to get pregnant at this particular time, they also have a chance to get their eggs retrieved and then maybe preserved too. So whenever they are ready for pregnancy, they can come back for their eggs and then they get their eggs treated and then transferred back to them. So we have a whole lot of people like the diplomats and the air hostess and others who don't even have time to get pregnant at a particular period of time, and then they are young. So, as you are young, you have the best quality of eggs, and as you advance in age, the quality of the eggs keep decreasing. So, like you mentioned, before you get to the age of 46, you like have 1% chance. So, that is what we do too as well. So, at the early age, if you have a good quality eggs, you can get it retrieved and then preserved. That is one other aspect too.
Okay. All right, that's quite interesting. Now, I read, if I remember biology very, very well, if I remember the biology I learned, there's supposed to be just an egg that is released at ovulation, if I'm not mistaken.
Correct,
it's just one egg. Now, what's the guarantee? Because from what I'm listening, or from a layman's point of view, I feel that it's only one egg that can be taken out because, well, I expect that the egg would be mature at that point for it to be retrieved. If not, you can't just retrieve an egg like that. It has to be mature, it has to grow and all that. And if only one egg can be released, how many eggs does that mean it's only one egg you can take out, and then the woman has to go through this cycle, this procedure all the time just for her to get an egg fertilized? Is it just that one egg?
Usually, what you just described is it's what the prototype of nature's kind of reproduction. When I mean nature, unaided kind of reproduction. A woman is programmed to cycle, and at the end of her cycle, she produces 1 or 2 eggs, or even 3 in very rare circumstances.
Yeah.
But in IVF, we have this modality of treatment we call controlled ovarian hyperstimulation, or controlled ovarian stimulation, or using hyperovulatory medication. So when you administer that medication to a woman undergoing an IVF treatment cycle, the ovaries are pushed to produce multiple eggs. And so some could produce 5, some 10, some 20. In very rare circumstances, you have more than 20. Of course, in Europe, where I trained and shadow a bit, when you're getting to those levels, it's assumed you've done something wrong. But there are some people who have potential to produce that amount of eggs in a short time, within an IVF treatment cycle. So now you could retrieve up to 15 to 20 eggs, all in one bit at the same sitting in the theater during the egg retrieval procedure. So it doesn't necessarily have to be one. Then out of all of that, the embryologist who will analyze them, and
you select the best quality eggs. I think from their morphology, you get to see their shapes, how they look like, and then some are treatable, some are not treatable. So you can actually get, I think you can, but in rare cases where a woman produces 15 eggs and then maybe all the eggs are good. So you select the best quality eggs and then you treat them. And when it comes to transfer, you transfer the best quality embryos. That's the ones who are able to grow to a particular stage, and then just the way they look, by the way they look, and then their physical appearance and other things as well too.
Okay, all right, that's nice. Thank you. And this procedure now, like I said, I'm talking from a layman's point of view. If I walked into a hospital and you told me you wanted to retrieve my eggs, I would get afraid. First and foremost, how are these eggs retrieved? Do I have to go through a surgery? Do you have to cut me open, to be able to retrieve my eggs? Or, what do you really do to be able to retrieve the eggs that are inside of me? Because they're actually inside of me. And you are outside of me, so...
A lot of women ask these questions. You see, the eggs are located, that they are in the ovaries, okay? And the ovaries are in the pelvic cavity of the woman. They're down there in the pelvic, around the hip of a woman. And during this administration of medication, the ovary can actually enlarge in size because there are multiple eggs in their follicles, their shells growing. So they're down there, close to the vagina. So yeah, close to the vagina, that's the best description. So what happened is that on the day of egg retrieval, the woman is taken to the operating room and she'll be given some medications. She'll be cleaned. Usually you expect that her bladder is empty so that the bladder doesn't come in between you and the ovaries. And so you avoid complications by emptying out the bladder, or the one empties the bladder. Then we have this ultrasound scan we call that looks like a penis. It's a probe. You insert it through the vagina like you're scanning the woman. And the needle guide attached to the probe. And then you have this needle that's like 30 centimeters. Very tiny needle, very tiny, just very, very tiny. Then you pierce through the wall of the vagina with it. She's already under pain relief, under sedation, or under some form of anesthesia, so she doesn't feel a pain. So you send the needle under ultrasound guide through a safety part to the ovary, and then you suck it out, because the egg is in the oocyte is in the fluid somewhere. The follicle has the oocyte with the fluid, so you aspirate it. So you do that for all the eggs, the follicles you see, and then this fluid you aspirate contains the egg, and then the eggs are taken out and prepared in the laboratory. So at the end of the procedure, the woman doesn't even know that anything has been done, because there is no single cut. There is no any formal procedure done. She just wakes up and heard that egg collection is done. She may just feel some pain, needle prick pain on the walls of her vagina, and she goes home not knowing. She goes home immediately as soon as her eyes are, her system's cleared of the medication used for sedation. So it's that simple. Just a day procedure. It doesn't need an admission. It doesn't need any. It just needs you to come. Of course, don't come with perfume too. We don't like perfume in this case.
Okay, so that means there are certain things that let's put it. There are certain things, preparations that a woman must. There are certain things she must prepare before she comes. You are talking about perfume. Are there other things that you don't want a woman to have when she comes in for a procedure like that? Are there other things that she must not do before she comes in for the procedure?
Yeah, I think a lot of women keep asking questions like, is there anything I need to eat?
Yes. Diet.
Yes, is there anything I need to eat, or is there anything I need to drink, or I should stop? All those. So, but we usually advise people who are taking alcohol or smoke cigarettes to avoid that during the period of the IVF treatment entirely.
Sorry, how many weeks? Okay, a woman has been a smoker for years. She has been drinking for years. She needs to come in for an IVF procedure. How long before she starts does she stop?
There is no there is actually no particular time frame to when she should stop. But usually your first contact with the doctor, when you are indicating interest in undergoing assisted reproduction technology, those histories are gotten from you as a woman, whether you smoke, what you smoke, the quantity you smoke, or whether you drink, the substances you drink, and the quantity you also drink. And there is no amount of smoking or drinking of alcohol that is safe when reproduction is in question. She's expected to stop from that point in time. Yes, because it's not safe before the process, it's not safe during the process, it's not also safe after the process of IVF, when reproduction is in question here. So she should stop from the first time she consults with a doctor. We know these are not easy, but it's advisable to stop.
Okay. Thank you so much, Dr. Ken and Mr. Paul. I'm sure we'll be back to ask other questions concerning this. Thank you, viewers. Thank you very much for tuning in. And I hope you come back so that you will hear a lot more about the egg retrieval process. Thank you very much.